Are you already on Wikisana?
I warmly welcome you, dear viewers, to our format Natural Medicine. It's great that you tuned in. Our channel always strives to provide a holistic view, especially on health. Today I have two valuable guests with me, with whom I would like to talk about a holistic concept and much more. With me is the specialist in internal medicine Dr. Med. Harald Burgard and Michael Husung. He is the managing director of the company Medica Germany and co-founder and owner of the company MedSelect. Stay tuned and look forward to my studio guests. See you in a moment. Welcome, you two. Nice to have you here, dear Dr. Med. Harald Burgard, dear Michael Husung.
Thank you very much. Thank you.
I already mentioned in the introduction that we would like to talk about a holistic concept. But first, let's look at the so-called trends in medicine or precision medicine. We also want to talk about that and why it is so important to look at people individually.
Exactly. Yes, dear Alexandra, I started over 20 years ago with medicine and then as an internist, and then treated patients who came with one or two diseases. Most of the time it was older people who went to the internist. Well, over the years and decades, that has changed significantly. So now more and more young people come to us, so really also children with autoimmune diseases, with chronic diseases like rheumatism and things like that, but also more and more people who are chronically ill. They come with various things, lupus, thyroid disease and whatever, or chronic pain of all kinds. And that does not only feel more, but the statistics also show quite clearly that we have an increase in this disease. Also the allergies. Why? Why? We will talk about that in a moment. And of course it is also the case that people get older. They used to die from accidents or from infectious diseases. This could be prevented relatively well by doctors and technologists, but people get older. And when you get older, you also notice the accumulated environmental toxins and other things more. And that just makes people sicker. But of course you also want to stay fit in old age. You always hear, 70 is the new 50. And people today are of course also fitter in old age and just want more quality of life. And if you want more quality of life, you have to look, how can I achieve that? Especially when I am chronically ill. I have pain, autoimmune diseases, allergies, whatever. And this desire for physical and mental health and more quality of life, that is a trend that you read again and again, but that you can also use only if you make a medicine that can afford it. And that is why the desire for therapy opportunities has become so great in contrast to classical school medicine. We can of course diagnose a disease as a classical school physician, but we can mainly treat the symptoms. We usually don't go into the causes. You don't learn that as an internist. Nevertheless, there are opportunities to do that. And that's what I've been doing for almost 20 years now. And that's what I or all of us colleagues who work in the field serve as holistic approaches. Although holistic does not mean that as an internist you look at the lungs, but also in the mouth. But that you really look at the whole person, with everything around it. And then try to diagnose the causes and what we call individual precision medicine. What does that mean? When I say precision medicine, there is already precision in it. That means I have to be more precise about the things that affect me and not anyone or everyone. There is no hat that fits everyone. You just have to look at what the person in front of you has. And that means it's personalized. I have to know, what do you want from me? What diseases do you have? What problems are there? To do this, of course, we use a relatively extensive questionnaire of almost 20 pages. This is often a small return to the past for the patients, so that you can even recognize what you really had. How did you live? How do you eat? What is your lifestyle? Where are the diseases, vaccinations, whatever? I'm often not aware of that. But when you go through it retrospectively, you become aware of it. And then, of course, it is also important to look at what kind of genetic system they have. How does the person who is in front of me react? Can he detoxify? How does he react to environmental stimuli? Does he react normally or does he have an excessive reaction? All of these are things that we can measure today. And they are decisive about how a therapy affects and what I have to do. How far I have to go with the burden of toxins, of pathogens, and so on. These are also epigenetic phenomena. That means, how far has the environment already got you? What has it already changed in you? What can we measure? But what we can also partially or even completely reverse. All of these are things that you can look at, that you can measure. You can look at what you tolerate in food, what you react to, when it comes to allergies or intolerances that are often not associated with allergies. There are people who, for example, have a nickel allergy. When I ask the question, they say, no, I don't react to fashion jewelry, because no one wears it anymore with nickel. But they react to food that is contaminated with nickel. And they don't even know that. All of these things can and must be diagnosed. And that in a holistic concept. And that is the next, the integrative. You just have to offer a comprehensive diagnosis and treatment. And not just black and white thinking, only school medicine or only alternatives, but really combine what you have of possibilities. School medicine is fantastic in its diagnostic possibilities. You have to be able to use the knowledge. But where the therapy then reaches its limits, symptom therapy, I can then continue to look and say, here we come, we look for alternative procedures for allergy treatment, such as bioresonance or ozone against pathogens or whatever. And apply new therapies, such as a high-tech modern blood wash, to remove environmental toxins. And then, of course, if we do that, we not only have therapy, but if I take out things that can annoy you for years, of course I also have prevention. You know the saying, the smart man or the smart person preempts. With that, I can prevent diseases once. Now, when I treat them, but also in the future. And if I recognize early on what's going on, or also treat young people early on, who come with Hashimoto's disease or with chronic intestinal inflammation, colitis ulcerosa, and so on, if I treat them today, they will have peace for the next few decades. And thus also avoid side effects, which, as we all know, silent inflammation can also trigger bad things. We will talk about this again at another time. All these things are important, and that's why we have created a concept from years of experience, from scientific findings, which we call Holobiom. You know, you always think, the person in front of me is the person with all his cells. What we often don't even think about and don't have in our heads is that we carry 10 times more foreign living beings in and on us than we have cells ourselves. We have 10 times more bacteria, often from the millions of viruses that live with us. And without them, it's not possible. Bacteria-free means death. So we also have to take care of the types that live with us, have to feed them well, have to make sure that we don't poison them with shampoos, with any other polyglycerides or with poisons of any other kind, antibiotics and whatever there is. We have to see what's going on overall. And as I said, we do a detailed analysis, we look at the whole person with all his structures, we look at how he lives, does he have a lot of stress, what can you do about it? Of course, we also measure in the blood, in the urine, in the stool, what's going on, what kind of stress does he have, how does he react, what I just told you. We recognize how the genetics are, but we also recognize defects. How many people come and have serious deficiency symptoms? You read again and again, we are all well taken care of. That's a fairy tale that they tell, who have never measured. When I measure as a doctor, then I see a large number of deficiency symptoms, no matter if vitamin D, selenium, or whatever. Then the intestinal flora is disrupted. You don't even notice anything. You notice you're sick or you don't feel so good, but if you look behind what's going on, that's amazing. And if I don't compensate for these deficiency symptoms, that's like driving a car without air in the tires, without oil in the engine, without washing water in the tank. That works, but it doesn't go well, and at some point the car stops. So we have to see what's going on and then you treat it. What we now see as an example of detoxification is this Toxopheresis, a treatment in which environmental toxins are pulled out of the body in a kind of blood wash, can prove, and then in the laboratory can also prove what's in there and what we find in people. That's amazing. We'll talk about it in another session. Of course, it is also important not only to treat once, but also to check over time what is changing. Is it getting better? Do the infections go back? Do the deficiency symptoms go away? How are people doing? And then decide how it goes on. This concept is the so-called holobionic concept with this specific blood wash. With this we can now also prove what long COVID does, what tires people, which parameters are responsible for it. And we can also prove that we can measure these things in the laboratory and thus also help people. And so that not only I work with it, but many people enjoy it. There is the company MedSelect and Mr. Husung will now report on it.
Great. Thank you very much.
Thank you.
In the end, we designed or created the MedSelect for therapy concepts or therapies like Dr. Burgard uses them. I always followed this show with amazement. And we both came together at some point and said, we are founding a company called MedSelect, so that other medical partners, cooperation partners in this form, come to these therapies, to this enjoyment of these therapies. And that's how we created a cooperation, a community that deals with patients in a holistic way. That means we had a lot of individual cooperation partners who are also treating in a holistic way, treat and care for patients, but who should actually learn from each other. That means my vision or our vision has always been, how do we get these partners together? That means, how can I ensure a medical second opinion, an exchange among each other? And yes, these data that come from all these systems or analytics, how do I get them bundled again, so that everyone has something of it? That means, how can we make case reports out of it? So how can we get out of studies there? How can we continue to make this public? Yes, and also not to be disguised as a certain scoundrel, but to operate data-based medicine. And yes, since I basically come from the manufacturer and we were looking for an interface for these medical partners to be there, that's how MedSelect came about. And this cooperation is of course brilliant in this way, because we also have partners who, as we call it, can make certain assignments in this Toxopheresis center. That means, basically, maybe as an example, I have a medical partner who does not have the capacity or the know-how to implement this component of Toxopheresis or therapeutic apheresis in general. Of course, he can also operate in the community and can recommend this patient further. He can also continue to take care of him. He can be there for the Toxopheresis. He can travel with the patient. But he can also operate in a nephrological center, for example from our side, which has joined us as a cooperation partner. And can, let's say, have the Toxopheresis performed there and go back to follow-up, to further care, to the therapeutic practitioner or where he came from. Or to a center that simply did not have the capacity. And thus we offer an extensive portfolio of training for these partners to transfer the knowledge among each other. You just have the opportunity to get a medical opinion. So to exchange the experience among each other. For this we do, for example, once a month a certain jour fix, that's what we call it. That means the medical partners come together in an organizational way, can exchange, can talk about their patients, can discuss what successes they have or where there are, for example, failures. You just have to look at it that way. And for me as a vision, also as a manufacturer, it was always the vision behind it. How do I get as many doctors together as possible? Or how do I get, if we need a cooperating dentist, who can't do the Toxopheresis himself, but who supports us also in the opinion, for example, when it comes to side issues, etc. Inflammation in jaws, topics, and so on. And as a result, the network has expanded relatively quickly. That means we are now 14 centers or 14 cooperation partners, also in Switzerland or now in Spain. So you have to see, of course, everyone who joins us now has to be trained, depending on their status or vice versa, they train us. So you have to see that too. That means you have a nice exchange. All data flows together via laboratory cooperation. Everywhere we do the Toxopheresis, the data flows in automatically, anonymously. That means you always have the patients. In all practices you have a course that you can follow and can also see at the same time. Proof, for example, autoantibodies, how do we reduce them, etc. You can see that about all patients. That means I don't just have the data in the MedSelect of Dr. Burgard, but we have them for all partners. That's brilliant. We can publish it. And the whole thing then expands steadily.
Yes, thank you very much for the insight into MedSelect or into what you have as a concept. I find it totally exciting, because what you said at the beginning, I thought, okay, that's very challenging for a doctor to be able to cover all this. And I think that's a brilliant idea, to create a network more or less and also to be able to exchange and to say, this is not my area of expertise. I'll pass it on to another area of expertise and then we'll join together. You really wish that for a patient. And we humans are not machines. In fact, we all need a very individual view. I still have a question in the back of my mind. Can you solve or treat all the problems with the toxopheresis?
Yes, that is, for example, an advantage, a big advantage of MedSelect in the sense that we, as a joint community, also behind toxopheresis in the therapeutic field, or in the therapeutic apheresis area, there is always a huge buzz, I'll say, which is confusing for the patients.
Hinter der Toxopherese im therapeutischen Bereich oder im therapeutischen Apheresebereich gibt es immer einen riesen Namenswust, sage ich jetzt mal, der verwirrend für die Patienten ist.
Many speak of immune adsorption, many speak of filtration. If you also follow forums, etc., then suddenly lipidopheresis comes up, which concerns completely different filter technologies, comes up all of a sudden. And we basically offer our practices as a community the possibility to switch between a certain filtration technology or various filters, also in the filtration technology, as well as to go into the adsorption area. So that means basically disease-related or therapy-related to change the toxopheresis. That's a name, because it has to. I always say the child needs a name, that's clear. But behind it is the medical background. And that has to happen independently of the manufacturer in such a way that you say, the patient's illness or the cause of the patient has to be treated. And the doctor or the partner we have needs a certain freedom to switch between technologies. And of course, we offer that as a community. Of course, we offer that to our cooperation partners. So that means you can today, technologically in the area, if you're talking about environmental toxins, etc., you can use filtration techniques in the double filtration area. That means plasma is separated and filtered on the other side, but you can also work in full blood procedures. That means we can switch there. We have adsorption techniques behind it, so various columns with adsorbers, where the doctor's practices can actually be used so that they say, okay, I'm doing it on purpose for the patient and their cause. And not, I'm going somewhere and do an apheresis, as it is also called. So in the therapeutic area, do an apheresis, I'm tied to a manufacturer there and yes, I'll do it now. And we try with a jack-of-all-trades method to treat our patient. From our point of view, it is technological, innovative freedom to create with the doctors and partners. And that also means, if I'm in the field of eye health, where we will also talk about it in the next report or in a subsequent program, we will hear a report from an ophthalmologist, for example. What does an ophthalmologist have to do with an apheresis? But in cooperation you also use the experiences of the ophthalmologists who come along. And that is, for example, point where I then say, okay, technological, innovative freedom. And I can't do that in the form or guarantee if we didn't offer a wide range, also in terms of technology and technological innovation. And if I speak from the manufacturer's point of view, from the medica, to support this input also in data or also in the field of research and development, that means innovation for us. And innovation means, what does the market need? Which things have to be filtered? Filtered always means in this respect, in our case, filters have to be absorbed. So it's always a myth that the whole thing is a sieve. So the technology behind it is a kind of flooding, a sponge frame that is in different pores.
Ein Schwammgerüst, das in unterschiedlichen Poren ist.
And that's just things, or also in coatings of the membranes that are behind it. But yes, that goes very deep. But basically, technologically freedom, innovative freedom, also with the doctors. And that is one of our missions that we achieve.
That's always the point. If you work as a doctor, you have the people in front of you, you do something and then you realize you're reaching your limits. It doesn't work. And that's where you learn the most. Either you say to yourself, it doesn't matter, or you take care of it. How do I solve the problem? And that's just the huge advantage that we have a swarm intelligence. I've always done that before. People write in and say, here, I have the patient XY, I can't get any further. Tell me, how do you solve the problem? Or just an idea. That's the big advantage of such a platform. And the second advantage is just, I don't have a device and a filter and that's it. And then I can't change anything else. But I can say, okay, we basically take our filter A for the environmental toxins. With that, we just take all the paint, the whole thing out. But in special cases where I have to do something completely different, then I also have the filter B or C available and can change that without having to go into cooperation with any other company, without having to use all the crampons around it. Then we have to put 5 devices there. That's just the big advantage, that everything fits together. That we can say, even when special things are there, here, come on, we have this problem now, for example, these many long COVID patients, these many patients with side effects. How can we solve the problem? And if there was no smart solution for that, you could of course also develop something like that innovatively. But you can only do that if there are enough people, if the ideas are there, and if you have data. And that's just the advantage of our platform.
And the other way around is that, of course, it also plays into the cards to develop new technologies, membranes, to work innovatively with manufacturers in the field of membrane technologies. And then there's a reversal. So even there, in the private medical field, we get great feedback, which ultimately also helps us on the nephrological side with our connected centers, etc. That means, how often have I exchanged data today from patients? Analyzes everything, of course, but to show, okay, we're on the right track. In the filter technology, in addition to the approval, etc., you also recognize side effects. That means the device is approved, you can use it on the patient in the application area or also apply it in therapy. But you also recognize side effects that you didn't even know before when you got the approval. So that also means positive and negative influences that you can have. For example, various things that are absorbed, which may also be good for the patient, although I prefer to switch back to a filtration to just cap the tips, but to treat them more slowly. And I just like the fact that it is combined through chelate therapy, etc., in such a way as not to say, okay, we only have one remedy, but no, the toxopheresis is a serious building block for us, also a great building block, innovative for us to complement the therapies. But that doesn't necessarily mean that I need 5 therapy sessions and then you're better off. As a manufacturer, I've noticed this often enough that we do patients 1 week after the other. On the other hand, we also have a good chance. The patient is doing 60 to 70% better, but there is a certain point missing, trick to just get over it. And then it goes straight through forums, I'll just say it now, yes, that doesn't work, we switch back to another procedure. Therefore, if you see it in a holistic way and look at it in a holistic way, it is actually worth gold. And we really wanted to bring that to all our cooperation partners.
That's what he just said, that you don't just do a therapy and then pull it through and say, here we do something 10 times a week. That is not helpful from our point of view. But you have to look, what does the guy in front of me have? What kind of defects does he have? What kind of stress does he have around it? And what can I get away with? He just has to take some things to compensate for his deficiency. If there are pathogens, you have to treat them, and so on and so forth. And this concept in connection with this high-tech detoxification, that is what from our experience, from our point of view, helps more than if I just pick one component out and say, here, he is to blame or that helps.
I think an important point is still, where do I actually find the whole thing? Because basically our partners themselves, yes, we are a community. That means every practice is an individual practice for itself. That means we don't have a name as MedSelect centers, but we are a service provider, a support for the practices and not a name giver. And we don't own these practices. It's like this, our partners will ultimately recommend, so the patients can contact us on the homepage. We recommend what is in your region, recommend doctors who belong to it.
Empfehlen Ärzte, die dazugehören.
And we do that, and then we are also out in that form. That means, in the end, I only prepare the way as MedSelect, as a service provider. I prepare that the patients basically learn where in their region the next of these cooperation partners is, or where the cooperation partners can also agree on each other who has the time, if possible, time for the patient.
Die Kooperationspartner auch untereinander abstimmen können, wer hat denn jetzt auch in naher Zeit möglichst Zeit für den Patienten, ja?
If I postpone everything to Dr. Burgard, then I get an appointment next year. That doesn't help me at all. And that's why we said we switch the MedSelect in between, don't publish a public community yet in the first step, but we help the patient then also about us in the vicinity or sitting in their vicinity, to simply find the partners.
Wir helfen dem Patienten dann auch über uns in der Nähe oder in ihrer Nähe sitzend die Partner dann auch einfach zu finden.
That means we convey that in that form, or we recommend that in that respect. And then we're out. Then the doctor can talk to patients. Then we're out in that form. But yes, they first know where in their region the individual adjacent cooperation partners are. Exactly.
And the cooperation partners, they also know, because we said that it is about seeing beyond the edge of the plate, not just doing one thing.
Yes, they are also trained by us. That's the point. Of course, they are all smart and have experience, and that is also a huge advantage. But there are certain things that one or the other can do better than the colleague. And they are all brought to the same level with the same diagnostic and therapeutic possibilities. They all know which laboratory values you can do. They all know where you can do it. They are basically filled up at the gaps that are there, so that the patient has more or less the same level everywhere. And above all about the cooperation, also about the background advice, about the expert advice, what is written there. Of course, as a doctor, you can get the answers that you need in our team or in the community.
So when I reach my limits, I always know someone to contact. And that's really great, also for the patient. He doesn't have to do patient tourism from practice to practice to practice, but I stay in the position. The people there support me all the time, and that also technologically.
There are such therapists, and I am happy as a patient when I get recommendations where I am still really good at. I don't have to look it up myself.
Or I'm in an existing practice that lacks this component, but I'm actually satisfied. Yes, but then this practice has the possibility to give the patient a center, at least to continue to fulfill this component. And that's actually the great thing we've done now.
Where do you find a patient, or also the therapist, or someone who is interested in joining you here? If I may say so, where do you find information?
In general, let's say on the therapeutic side, we go specifically to the partners, or the partners come to us. That's definitely the case. The community in the cause therapy already knows each other, so I would like to say that. There are various conferences where the partners talk to each other, where Dr. Burgard gives a lecture or another of our colleagues, and they will pay attention to it. The patients themselves simply have the opportunity to make a request via our website, and then they get the information where the next partners are. www.med-select.de.
Okay.
Can the therapist who may see us on TV contact you there? Okay, so one address for everyone more or less.
One address for everyone, yes. There are the contact details in there. We are all welcome to get in touch.
Where can I find you if someone says I'm taking a little waiting time into account?
I'm in Wartgassen in Saarland. www.drburgard.de, but, as I said, also via the request at MedSelect.
Yes, I've already noticed that it's very easy to find you on the internet. Just Google and you're there.
Yes, you definitely have to say that we can now work well in Germany and Switzerland on a large scale. Or even cooperate.
I think that's a very strong idea. Congratulations for this decision or for what you've done. especially when it comes to long COVID or these exhaustion issues. I haven't really heard anything smart so far. I already have an idea of who I would like to recommend to.
Somehow we have to be armed for it.
Yes, exactly. Thank you very much for being here and for the enlightenment and for opening this window, also for therapists. I wish you a lot of success and that it bears a lot of fruit and that it grows and that it benefits many people.
Ja, vielen Dank.
Vielen Dank.
Ich freue mich auf weitere Gespräche mit euch und sage jetzt erstmal für den Moment Wiederschauen bis zum nächsten Mal.
Ja, vielen Dank.
Danke sehr.
Danke schön.
Wiederschauen.
Thank you very much.
Zuschauerinnen und Zuschauer sage ich
Thank you,
herzlichen Dank
dear viewers,
fürs Zusehen
for watching.
und ja, vielleicht fühlen
Maybe
Sie sich
you
jetzt
feel
auch
addressed now
angesprochen
and have now
und,
possibly
haben
heard a solution for what
möglicherweise
concerns
einen
you.
Lösungsansatz gehört für das, was Sie betrifft.
Or even if
Oder
you
auch
are a
wenn Sie
therapist,
Therapeut sind,
then we would be
dann
very
würden wir uns
happy.
sehr freuen.
In this
In
sense,
diesem Sinne
I am also
freue ich
happy
mich
if
auch,
you
wenn Sie
tune in
das nächste
again
Mal
next
wieder
time.
einschalten. Bleiben Sie bis dahin
Until
bitte
then,
wachsam, achtsam
please
und
stay
fein,
vigilant,
liebevoll zu sich
attentive,
selbst.
and above all
Bis zum
loving to
nächsten Mal. Auf
yourself.
Wiederschauen.
See you next time.